Hello, my name is Charlie Donahue, and I'm very happy to be here working with the Activist Lab at Boston University School of Public Health. I have a great love of activist people because I was myself considered an activist, starting off in the Peace Corps when I was in Malaysia in tuberculosis control in a very isolated part of Malaysia, and really had to figure out how can we make things better. I worked at the Boston University Center for Health Planning. It was a part of the medical school for 4 years, where we used to advise health planning agencies, state and regional, throughout New England on what they could do with access, quality, and cost issues. I was around when the Boston University School of Public Health was an idea. I had the opportunity to meet the founding faculty members and was an academic, an adjunct assistant professor for many years, working with students that had ideas and wanted some suggestions. I also am a proud father of a daughter who went to the BU School of Public Health and then got not only involved with health policy and law, but went to the Northeastern Law School and now works with the second largest hospital in Massachusetts, but also worked with a lot of the activist groups in Massachusetts, health law advocates, health care for all, groups that are really the backbone of some of the innovation that has come out of Massachusetts. So I go to meetings with my daughter, and she introduces me to all the young people, and I introduced her to all the older people who have had a big impact in changing things in Massachusetts. One of the topics that we will cover is in the Activist Lab of what we did in my field of health planning to change the system. What did we do to change issues of access? What did we do to change issues of quality? What did we do in the area of health cost containment? We worked mostly with unions and employers who were trying to reduce their health insurance costs without cutting benefits to their workers. I did have the opportunity when I was in the Peace Corps to do a lot of traveling throughout Southeast Asia and then various other parts of the world on my way back from the Peace Corps, and that had a big difference in looking at international health and what we could do in the United States and what we can learn in the United States from innovations around the world. Very happy to be involved with the Activist Lab because so much change is going to be needed in the future, and we can learn a lot from what did we do in the past and how did organizations like community health planning agencies with the consumer board of directors get physician groups to work with us, and we wrote medical journal articles with them, educating them. And the best compliment I had with working with a group of surgeons for 5 or 6 years, publishing articles with them, questioning high rates and low rates of surgery, was that the method that we used to approach them was we wanted their advice to work with us. We were polite. We taught them about epidemiology, which unfortunately a medical school no one ever learns about, and what you can do as a doctor to look at systems issues. And this one surgeon said to me, Charlie, I love the method you used. I describe it as the velvet fist.